Thank you for joining us for this episode of Talking Health in the 406, where we're one community under the big sky. I'm Trina Filan, a public health evaluator.
And I'm Margaret Mullins, the Social Determinants of Health Program Manager.
We have with us today two great guests from the United Way of the Lewis and Clark area, which serves Lewis and Clark, Broadwater, and Jefferson counties. We might refer to this organization as UWLCA during this podcast because United Way of the Lewis and Clark area is a heck of a mouthful. We're going to talk today about how housing and public health intersect and why local interventions to address housing instability and homelessness can improve the health of whole communities. This is one of my personal passions. It's going to be a terrific conversation. Our guests are Emily McVeigh, Executive Director of the United Way of the Lewis and Clark area, and Jeff Busher, Community Impact Coordinator. Welcome to you both.
Thank you for having us.
Thank you, Trina. Happy to be here.
Housing and homelessness are major issues in many communities across Montana and the country, and housing is intimately related to health. According to the National Health Care for the Homeless Council, people who are homeless have higher rates of illness and die on average 12 years sooner than the general U.S. population. Poor health is a major cause of homelessness. Homelessness creates new health problems and exacerbates existing ones. People experiencing homelessness have at least twice the rate of chronic disease than people who are housed. For instance, rates of diabetes are about 9% for people who are housed and about 18% for people who are unhoused. Rates of high blood pressure are about 29% for people who are housed and about 50% for people who are unhoused. And for our listeners, we'll make sure to put some links to some useful resources in the show notes.
A key point here is that even if there's health care available to people experiencing homelessness or being unhoused, there's no amount of health care that can substitute for stable housing. It's an urgent need, and there is substantial work to be done on this issue. Emily and Jeff, can you each tell us about your roles at UWLCA and how housing came to be such an important focus for your work?
As the executive director, my job is to oversee everything that happens at United Way. We are one of the United Ways that has moved into community impact work. And for us, that means housing and homelessness. That has become our priority. That has become our biggest project. We also do work in free tax clinics. We have a volunteer website. We do a project called Kids Art. And we help in a lot of other ways. We do lots and lots of projects, but really our biggest focus has become around the housing issues in our community. And so in that, we do a lot of different things. We are the local continuum of care, and we hold weekly case conferencing meetings, which means we gather all of the case managers and other people in the community that work with clients that need housing. And we try to connect them to resources and to housing. Jeff helps with the showers program on Tuesdays. We've convened meetings, which we have done a really good job of taking the roughly 17 meetings that were happening every month and condensing that down into a more reasonable number of meaningful meetings with the community stakeholders in the last year, and really moving a lot of important projects down the road through the Community Health Improvement Plan action teams that Jeff started 3 years ago. We do a lot of work in housing. That actually all started about 7 years ago with the team that was here at the United Way back then, which you were a part of, Trina. And back then, they really jumped into that housing world. And with the FUSE project, the Frequent Users of Systems Engagement was one of the very first projects. And that is still one of the projects we sit with today. And St. Peter's Health has taken that as they are the lead of that. And they, about 2 years ago, hired the first case managers the success they're seeing with that project is amazing, and we could go into details about how that really focuses on the top users of emergency services, but showing that by providing them with stabilized care just changes the entire trajectory of a person's life, and really changes the way we spend money in the system of emergency services and housing and healthcare overall.
I would love to hear more about that as we progress. Eventually, we'd like to also have the Fuse folks on for a discussion as well. Jeff, why don't you tell us about your role and why housing is integral to what you do?
As Emily described, we not just Helena, Montana, but our country finds itself in a kind of a perfect storm of really not paying attention to the housing needs across our country. COVID pandemic did not help, but we have failed to keep pace with the need for, and I feel like this is a belabored term, but I'll use the term affordable housing. And by that, I mean homes that first-time home buyers can afford, homes that minimum wage earners might be able to afford, folks who are on vouchers or various subsidy programs can afford. So that particular area of housing, affordable housing, is it's a significant gap. I'll just share an example and why we started what project. When a person is given a voucher for housing, folks who may be homeless, folks who may be disabled, are awarded a voucher for approximately $1,000 a month through the federal government, whether it's a supportive housing voucher, a rapid rehousing voucher. There are other Section 8. There are a number of voucher programs, but they're awarded those vouchers and then told to go and find an affordable living space for $800, $900, $1,000 a month. That creates a significant challenge. Those vouchers are good for 90 to 120 days. And often in that time, folks are unsuccessful in finding a spot. Some of that is because landlords may be wary of voucher holders and past experience, and they may be set limits and say, "I'm sorry, I don't rent to voucher holders," things like that. So homes in that price point, anywhere from, or rentals in that price point from roughly $800 to $1,100 a month are very difficult to find. So identifying that need led us to a project we'll talk more about. The other thing I'll say from our experience this year, last year's point in time count, which is an annual count of our unsheltered population, revealed that we had approximately, our exact count was 181 unsheltered individuals, unhoused individuals in the Lewis and Clark area. And a lot of those, and my firsthand experience is through the shower program. I would guess over the course of the last year, we probably saw 10 to 15 people that came through the shower program who shared with us that this was their first time being unsheltered. They're from the area. They're not passing through. They're local, but this was a new experience for them. And so, common fact that high cost of housing leads to higher numbers of unsheltered individuals. That's just a general overview from the work that I do. The other thing that I get to coordinate each week is a conversation with our case managers and social workers from across the community. And we're able to visit about specific cases, specific individuals, and where they are on the continuum toward achieving successful housing. And that work is, it's hard when there aren't a lot of places to house people.
You've brought up so many good points that we definitely want to touch on. We'll ask it a little bit later about the point in time survey. I think it's really important for folks to know that a lot of the folks who are unhoused in our area are local people. These are folks who are our neighbors. They have long lives here in Helena, and that's the experience in a lot of places around Montana. Those are our neighbors. So that's a lot of good stuff to touch on. Thank you both very much. Tell us a little bit about that Showers program.
We just celebrated 3 years. We started in November of 2021. St. Paul's United Methodist Church. The backstory is that the pastor at the time the church building was built was a previous youth minister. And he said, when they built the building, he said, I want us to be able to have retreats here. And I want us to be a place where we can hold a variety of gatherings. And they put in the lower level, they have 2 men's and women's restrooms. And at the back of those restrooms are 3 very nice shower stalls. And about 3 years ago, the missions person reached out to me, and we reached out to the folks at Good Samaritan and said we would like to work together to offer a shower program for our unsheltered neighbors and possibly do that weekly. So my role was to be the volunteer coordinator and the street outreach person at Good Samaritan has been a helpful person to just be a contact for folks, and they help us publicize the showers. And the church, of course, made a huge investment. As you can imagine, thousands of gallons of water have gone through their showers over the years. I can tell you real brief numbers, and that is our first year, we had about 400 showers, and that's not individuals. I'll come back to the individuals. That's 400 showers. Second year, about 700 showers. And this last year, we were closer to 1,200 showers. On an average day, we see about 20 to 25 people. In terms of numbers, our first year was about 50. The second year was about 112. And I think this past year, we were over 225 different people utilizing the showers over the course of the year. And it's folks who are sleeping in their cars. It's folks who are on the streets. Sometimes it's folks who are lodging at God's Love. It's a wide variety of folks. And as I shared, sometimes it's folks who are newly evicted and they're maybe living in their car or other places, or even couch surfing with friends. But it's nice to just get out and get cleaned up. And sometimes we, of course, are able to do this for people who are preparing to go to an interview. They just need to be cleaned up and ready to go so that they can present their best selves. It offers dignity, and we, of course, try to treat them well. And some other things that have happened over the course of this project is our good friends at the Rodney Street Laundromat washes our towels each week for us. And the good folks at Van's grocery store provide a couple dozen donuts for the crowd each week. And so folks who've come alongside of us and helped support that project. And it's just been a great, and besides providing that service, the other thing it does, it allows us to get to know these folks personally, learn about their needs, and on occasion, we're actually able to help them with various needs. I remember once a gentleman needed a part for his car. Well, I think the part was $100. And the volunteers there at the shower said, let's just pool our money and get him the part. And so we did that. And on another occasion, someone had a camper that needed a small repair. And one week we brought our tools and made a small repair on that camper. So you just never know what people come up with in terms of needs. And sometimes we're able to meet them. And sometimes we do a lot of referrals to folks like Pure View Ministries and Good Samaritan. So it's just been a great project.
Jeff, ever since I've heard about the shower program, I have been so impressed by it. And what a beautiful example of when people and resources come together to fulfill a need. you might not be able to house that particular individual in that point in time. But like you said, it provides dignity and it provides a resource that's really invaluable. It's great. So thank you for giving us some more information on that. So I'm really interested in hearing about your work because housing is intimately connected to social determinants of health, which are those underlying social and economic conditions that influence people's ability to be healthy. Housing connects to all parts of our lives, including economic stability, educational attainment, and community development. I've often heard that a few different things need to be considered for housing to be adequate: accessibility, stability, safety, quality, and affordability. So Emily and Jeff, can you talk about what each of those mean and how they impact housing? Emily, why don't we start with you?
So when we look at finding housing for people, of course, the first thing we look at is affordability. Can a person afford to pay the rent? One of the big things that we get stuck on is first month, last month, deposits, all the things that are required these days to get people just into an apartment or a house. It's very expensive to move. So, that's one of the first things we look at is affordability. The standard for a very long time has been somebody should be paying 30% of their wage to rent in utilities. That is just, kind of out the window right now. It's just not even something we can look at because there is just nothing out there that is within that range of affordability in our community or our state, really. And so we look at, can we keep people within even 50% of their wage? And, so that they're not paying more than half of their income toward rent. And that's even pushing it. We talk to a lot of people who are paying 70 to 90% of their income toward rent, which I don't know how you make it through the month at that point. How do you eat? How do you pay for your medications? How do you pay the rest of your bills? But people are making it. People are making it work. So looking at affordability, that's one of our biggest first things. When we look at who has become homeless in the last few years, we know that COVID obviously changed the world in a lot of ways, but it pushed a lot of people out of housing because housing became so expensive, especially in Montana. Lewis and Clark County had the 5th highest rental increase in the country between 21 and 22 because we were so stable for so long as a government community. Things just didn't change here. Rent was the same forever. And then all of a sudden, everything exploded. And what we saw was people on fixed incomes, especially senior citizens, could no longer afford the increase in rent. Their vouchers no longer worked on the apartments because fair market rent actually decreased during that time somehow, which none of us understood and still don't understand. We did finally it is finally increased, but what we saw was the fair market rent rate at the federal level was going down. Rents were going up. Vouchers weren't working in apartments, and people were losing their places to live, and they were on fixed incomes through Social Security or maybe a pension or maybe, some combination of those things. And what we saw in Montana was what they call the silver wave in shelters. Is the biggest increase in shelters was people over the age of 55 and even over 65. And how do you live in a shelter when you're over 65? I just can't even imagine. And, they saw those lengths of stay in shelters growing from, what used to be a few days to 3 months to over a year. And so, we just saw all of that really changing due to the affordability factor. And so then people really started looking at, well, we'll just give up all the rest of those things. Maybe the safety factor goes out the window. Maybe we look at something way further out of town. So it's not accessible. Maybe we look at something that's not as stable. Maybe it's a month to month. And so all of the rest of that started to waver in their minds because we just needed something that was affordable. we really started to see people kind of juggling all of the different things that you would normally consider just to keep a roof over their heads. But, what we really would like, for people to be able to look at is, do you have a decent car? Can you get to the place you need to live? Is it something that you're going to be able to stay in? Because do you have kids? Do you want that kid to be able to go to the same school? You don't want them to have to bounce around. So you want that long-term lease. So you want to be able to stay in that home for a long period of time. You want that to be stable. Safety, obviously, you want running water and you want the roof to stay on the house. You want doors to close, all that kind of stuff. And especially when you're living in places that have vouchers, there's pretty strict rules. And so those things all have to happen. And they just went from the old requirements to what's called Inspire requirements. And so those are all in the process of changing, which are all good. But a lot of, like Jeff was saying, the landlords will say, oh, I don't want to take vouchers. But now they're saying, I don't want to upgrade to the Inspire requirements. So now they're not going to take vouchers because of that. We love to make sure places are safe, but if it's costing money and if it's causing heartache, we won't do that. So, of course we want places to be safe, but it also creates struggles for people to get, places that are affordable that take vouchers, because the landlords have to pay the price for that. There's no reimbursement for the landlords to make sure that they meet those requirements, which is unfortunate because it does sometimes cost a lot of money to make sure you're at that Inspire capacity. So
Thanks for that, Emily. Jeff, you have anything to add to that?
Yeah, I'd like to focus on the stability piece of that question for folks who are housed or newly housed. And this is a program that we are just getting off the ground. We've just assigned our first 2 or 3 customers or clients, if you will. And we call it a home team. What we found is when folks are newly housed, coming out of homelessness, and often chronic homelessness, and they are moved into an apartment or a small home, they are not used to living indoors, and they're used to socializing with a group that lives outdoors. And there are certain things that will help them stay housed, and that is simply learning to live indoors successfully. For example, if it is an apartment setting, not playing your TV or your music so loud that it bothers the neighbors, following the cleanliness rules when the garbage goes out. And often, if you can imagine, an unsheltered person often has to hoard and collect things. Well, when you have a home, you may continue to do that, but now you have a home and a safe place to keep things, and helping make sure that home stays clean, and by clean I mean safe and healthy and those kind of things. Simple things as what to put down the toilet and what not to put down the toilet, what goes in the garbage disposal, those kinds of things. And the first few months of being newly housed are the most critical. And so what we've developed is right now it's a small team. We've just trained 4 or 5 people, but we've trained some volunteers to pay attention and build a relationship with these newly housed folks and check in on them once or twice a week and just see how it's going. How are they doing? Do they have any questions? I think of a story of a gentleman who was fresh off the streets and was newly housed in an apartment. And of course, his best friends were other folks on the streets. And he began to have one over to spend the night on a cold night, and then 2, and then 3. and soon this gentleman was uninvited from his apartment because of his kindness, because of his desire to help his friends. But it was not a rule that could be broken in that apartment facility. You just had too many guests and were causing problems. So the home team our model is simply to walk with these people in their first 3 to 6 months of being newly housed and helping them be a successful resident and a good neighbor and help them to plug into their new facility and stay there for a long time, hopefully. Because if we can keep them housed, that's one less person on the street that we're looking for housing for. So that's just one piece of the stability issue. And one thing we ran into more toward the end of COVID, and that was just the high number of evictions. And our good friends at Montana Legal Services provided a number of assistance encounters with folks who we saw. This happened for a time period where folks were losing their COVID funds, and then renters were, and I don't mean to put everybody in this category because it wasn't all of them, but they were suggesting I'm going to be raising the rent, and they were pricing people out, and so our friends at Montana Legal Services and others tried to help people stay housed, and one thing I'll mention, as we try to look at the big picture in our community, there are some important positions that in some cities, like our friends in Missoula and Bozeman, have positions that are paid like a housing navigator. We've had that here in Helena for a time. We currently do not have a housing navigator. One thing that we're working on right now is creating a position for a housing tenancy specialist who, again, would help people to find housing and stay housed. And then this home team that I described comes under the category of housing security, staying housed once you get housed. So those three positions are positions that I'll just say this: our nonprofit community is providing those positions, and I think we could do better in our community having some combination of government and nonprofit partnerships to help pave the way to make these positions more long-term and offer greater stability to our local housing issues.
Great, Jeff. Thank you for that. I appreciate the insights and affordability and stability that you really provided a lot more depth of information about the complexity of what happens. It is obviously not just about getting people into housing, but what happens from that point forward. And it is clearly complicated.
Yeah, I was just going to say that it seems like there's no issue that's the greatest housing need in our area, because each aspect has urgency, affordability, enough housing that is accessible and safe, housing that's available so that you don't have to live in, say, Powell County to, drive in and work each day. Is there something that really tops your chart as the most urgent issue locally?
I'll start by saying one thing that I feel like we're doing well, and that is the partnerships between our mental health agencies, our addiction services, the helping agencies, Pureview and St. Peter's Health. There's the healthcare folks in our community. I feel like we're communicating well, but the biggest hurdle that we face week in and week out as we discuss folks who are unhoused is where can they go? Where can they be? We have a handful of folks who are what I describe as non-compliant, because when services are offered, they are not interested in the services that are being offered. And for those folks, in the back of my mind, I'm thinking we need some sort of low barrier group living facility that a person could feel somewhat independent, but still be cared for, because these folks are dealing with medications and mental health issues and things like that. And a model is called supportive housing, where the support they need is available if they choose to take advantage of it, but it's not required. So that's why one of our projects has been a supported housing project.
Thanks, Jeff. Emily, do you want to add anything to that?
Yeah, I really think that, what Jeff was talking about, the supportive housing, it's the housing first model. And that's what we've been working from for all the years that we've been working on housing projects. We really fight the battle that people argue that, oh, so-and-so needs to get sober before they get housing, or so-and-so needs to get well before they get housing, or they need to do XYZ before we get them housing. They need to earn it. And that has been proven over and over that is not what works. We need to get a person housed before we can get them well. That is really the model that has been proven to work all over the country, all over the world. Because you can't really get a person well until they're stable in housing. And that is, we always talk about, like, if you're going to get them treatment, how do you even know where to go find the person to take them to treatment if you don't know where they're living? If where are they going to be on Tuesday? Who knows? It's really hard to get a person stabilized if they don't have a place to live. That is the core of a person's stability. And so really being able to get a person housed and then work on the rest of the things that got them to the place where they were unhoused in the first place is really where we need to start. So we talk to people about that all the time, and really try to fight that battle about how housing first is the most important thing. The supportive housing piece is important because you can't just also then throw them into housing and say, good luck, see you later. It's like what Jeff was saying was like the mentorship piece, because maybe they're not ready to just be housed. We don't know what they need. They might need mental health treatment or chemical dependency treatment. They might just need some independent living skills. People come to us in all kinds of different places, and we need to be able to support them through that for however long it takes till they're ready to be on their own, and then to move on to whatever next steps they're, So it's not just housing, it's that support piece as well. So I think it's time for people to change their way of thinking that people don't need to earn something. It's they get what they get the housing, and then we support them through their whatever their needs are.
Yeah, housing is the basis of preventative health care.
What an amazing point to bring up. It's so fundamental to everything that you have this sort of, chain, and every link in that chain is really critical. You can't just isolate those points. And you all lead me really nicely into my next question, because you've both been alluding to it. I know you are involved in a really big housing project. I wonder if you could tell us a little bit more about your supportive housing model.
Well, it's all of the things we've been talking about. Supportive housing has existed in Helena for a long time in a variety of ways. It's right now what you'd call scattered site. And so it's people that live in different locations and use the services through Helena Housing Authority, Many Rivers, Whole Health, Aware, any of the different programs that exist. But that makes it hard to track because you don't know where people are, what services they're using. There's a lot of turnover in this field, unfortunately. And what we're looking at doing is building one site where all of that would exist in one place. It's something that we've talked about for as long as I've been doing this work, is if we had one place where people could go and everything would happen all in one location, so that people wouldn't have to figure out how to get to services, because we don't have great transportation for people in Helena, Montana. And if they don't want to use the services on site and they have a therapist that they love in town, we still have to figure out how to get them there. So there's still options, but it means that people would have the ability to get the support services that they need in the place where they live, and have case management services, have that housing navigator or tenancy specialist services to, be able to say, okay, you don't need to live in the studio apartment forever. Maybe you move up into a bigger place when you're ready. But, just having those options so that when people move in, that they start to get that stabilization and then moving into the next steps of their lives, but having somebody there to walk them through that and not expect them to be able to figure out all of that path on their own. And, just really training up the community of providers in working together through that model. And I think Helena works together really well right now, and we can take it to the next level and making that work through one location of making just the services happen there. There's a program in Missoula, one in Bozeman. They're currently building one in Great Falls and one in Hardin. And so we're seeing this pop up all over the state of Montana. There's 300 in other parts of the country. So we know this program works. We know they can be successful. It's a really cool program once they're up and running, and they see huge amounts of success with people moving in and moving on with their lives in really successful ways. So we're really excited to see this come to Helena, because we have seen a huge increase in people becoming unsheltered and living in their cars and campers. And we really need to increase the amount of affordable housing, but we need to support people in getting there while they stabilize and then get into that next step of housing.
Jeff, do you have something to add to that?
Well, I would say that one of the hallmarks of the United Way in any community is that it identifies where gaps are in services. And as we have been doing this housing work for the past 5 or 6 years, and even those that came before us, and the work that was done, the statistics we looked at made it very clear that, as I spoke about before, that income gap, that low income housing was just a huge need. And for us to work to try to find a place where we could house folks affordably has been our work for as long as Emily and I have been here. We've looked at so many buildings. You probably remember at one point we were looking at the St. John's, the old hospital property. We're looking with this hotel. And let me just say that we're committed to doing this. We're going to make this happen, even if we have to build our own location. If things go sideways or things don't work out on our current project, then we'll find a way to make this happen because of several things. We've identified the need. Everybody, it's been kind of fun the last couple of months in this office to see how many people have come through the door or called us on the phone and said, we want to help. We want to be a part of this because we know it's a significant need in our community. So that's been very affirming. And we want to just be the lead agency in making that happen in our community. So we will continue. We will keep working on this, whatever happens with the current project or wherever it leads us.
We're most appreciative of that commitment to the cause for this project. I'm curious. You mentioned, these are these wraparound services, and you mentioned case management, Emily. Can you just tell me a few of the other wraparound services that would be provided in this scenario, at least as you picture it?
Well, we're currently in the process of holding meetings with all the providers in the community to see who would be interested in being on site. And what I feel like is we actually are going to have to start narrowing it down because everybody is so excited about this project. And really, we can't have everybody there, but we would love to, but that would be too big. which is really, really awesome to have everybody so excited about this. Anywhere from mental health treatment to parenting classes. One of the things that I'm really excited to bring in and build up is independent living training classes. And one of the things we hear from the people we work with on the streets, and we've talked about building that mentorship program, is people don't know how to cook, or they don't know how to clean, or there's just some really basic life skills that they're missing, or they knew at one point, or they don't remember how to do, or whatever the case is. When I was running group homes for teenagers, I would often get, 16, 17-year-old kids in that had never learned those skills. And so we were teaching the kids those things before they turned 18, hopefully, and went out on their own. And there's just a lot of things that you think that kids learned before 18, and then you realize maybe they never did. And now they're adults, and we're at that point. And so we'll build out that kind of a program. So anything from financial literacy to cleaning your apartment to car maintenance, whatever the community volunteers want to teach, we will have classes on site and teach. Maybe the residents will end up teaching each other, because you do have people that are great chefs and they could come in and teach the class. And, so we'll probably have a lot of that co-learning option as well. It'll be fun to see how that plays out, but we'll have a curriculum, and then we'll let people play around with that a little bit as people come in with talents and interests, but definitely having certain things that we will teach because they're basic skills that they'll need to have. Especially things like once they move out of our program, how do you talk to your next landlord? How do you work out issues that you might be having with your neighbors? What happens if you might be late with your rent? Making sure that they have those kinds of communication and coping skills that they might need in the next steps in their lives.
What a great scenario to have a plethora of people and services to sort of think about including in that housing model. It's pretty inspirational. I also just quickly want to ask, I think, Jeff, you brought up, or maybe it was Emily, the FUSE program. I am familiar with it. It's an important part of this story. And I'm wondering, how would this Housing First supportive housing model fit with FUSE?
FUSE has been a part of the conversation as we seek a supportive housing location. One example that comes immediately to mind is a partnership that FUSE currently has with local hotels, because when unstably housed or unhoused folks who may experience surgery at St. Peter's or Pureview or somewhere, they sometimes need a safe place to recover that is not as expensive as a hospital room. So one conversation we have had is possibly reserving a room or two for folks who may be recovering, who not that they would have I'm not sure we'll have medical care right there on site. However, we have talked about, for example, Pureview has a traveling healthcare van, possibly that kind of supporting housing facility would possibly be a monthly or a weekly stop for that kind of service. So FUSE also is very aware of folks who are frequent users of these systems, and they also may know that, hey, we got this person a voucher. This might be an ideal client. So referrals from the FUSE program could also be a significant kind of a pipeline, if you will, into this kind of housing. What else would you add to that, Emily?
We've talked about, do we save rooms for FUSE clients? They are some of the hardest people in the community to house. They've done a great job of making connections with landlords and housing some of their clients over the last couple of years. But due to the affordability factor and just their histories on paper, it does make it hard to house some of the fused clients. And so we've talked about that with a lot of different groups. Like the VA has reached out. They would love to work with us on having rooms for veterans and kind of recreating what we lost when the Willis Cruz House closed. And we've talked about rooms for kids aging out of foster care. And, so there's a variety of different groups that have reached out to say, would we be able to create a wing or, a certain set of rooms for this group of clients and have our case managers work with them. And so we've definitely been in conversations with a few different groups about that kind of thing. And then they come with their own services, which is nice and creative. So, that's not specific to Fuse. It's definitely something we've talked to a lot of groups about, but because there's just some groups out there that are harder to house, they need a little bit more security and they need more support. So it's, that's just part of the conversation is, do we save rooms or do we create pods or, how do we make that work within a building without leaving people out? We don't want to create a place where we're not being inclusive, not opening it up to the public either.
I wanted to mention very quickly one other service we want to provide in a setting like that, a support service, would be, and this is a changing landscape here in Helena. We're getting used to our new friends at Maximus, and that is just job skills, job training, and access to folks who may be able to work in the workforce and may need help with resumes, may need help with interview skills, and just what it means to be employed and what's realistic for them if that's a need. So one of the partners has been the job skills folks, and one thing as we're thinking through the logistics of this is I refer to this person, but United Way would probably have a staff person at the supporting housing facility who is what I call a service concierge, if you will, a person who gets to know the clients, gets to know the residents, and then is able to match them with the services they need, or at least offer them. And, I'm foreseeing a day when we have a menu of services, if you will, and folks can opt in and opt out. I'm seeing a day when there may be an AA meeting that meets on the property, things like that. So managing that whole array of services will be a just as you can imagine. Our goal is successful residents who feel safe, fulfilled, and able to better themselves and move on with their lives.
Thanks, both of you, for that excellent set of answers. It's a complex issue. As we've been saying, there are lots of needs to fill. There are lots of different types of folks who are experiencing housing instability or who are unsheltered. And one of the ways that is officially used to try to count and get a hold of how many people annually are living in unsheltered circumstances is the point-in-time survey. And you all are in charge of organizing that, and United Way of the Lewis and Clark area has done that job for this area for a really long time, maybe a decade and a half, maybe more. And Jeff has really amplified the performing of this task. So could you all talk about what is the point-in-time survey? When does it happen? What is it able to do? And what doesn't it do very well? And then we'll also later, after you talk about that, we'll talk a little bit about the continuum of care.
All right. The point in time survey is called that. And by the way, it is a HUD requirement. And they ask us to do our best as a community, and this happens across the country, on the last Thursday of January. And people immediately ask, why do they do it in the wintertime? Wouldn't it be easier to do it in the summertime? And the answer is no, because it's, as you can imagine, at least in Helena, Montana, I'm not sure all the gulches where people may be camping out and who are unhoused. So in the winter, folks are generally finding warm places to be in the city, and it makes it a little easier for us to count them. Now, the point in time, as I mentioned, is the final Thursday in January, and this year it's January 30th. And over years past, we have gathered volunteers who have gone out and kind of just looked in all the places where unsheltered neighbors sleep at night or stay or gather. And it's about a 20 to 25 question interview that these days can be done on your phone or on an iPad. And it takes about 10 minutes. Usually when we find a person and they agree to take the survey, we try to thank them with a gift card or a hat or gloves or whatever we can, just to thank them for their participation. Obviously, and it's not bribery, but obviously we want to encourage them to participate, because the goal of the survey is to try to assess the number of unsheltered folks in your county, in your area, so that and the reason HUD sponsors it is based on those numbers, federal dollars are directed toward that community that assists with the services provided, which we'll talk more about later, which is the continuum of care. But those funds rely on the number of unsheltered folks you have in your community. So we do our best to make those numbers as accurate as possible, but we often acknowledge that it's very difficult. Some folks are very independent, very private, and frankly don't want to be counted. They don't want to be that public about their situation. Frankly, they're embarrassed. They'd rather quietly go about their business. And so we know that the count is an indicator. And last year the first year we did it this way, Emily, or was it the second year?
Yeah, last year.
Yeah, last year was the first year that I mentioned the initial way to do it was to send folks out in pairs to try to find unsheltered folks. What we started last year was offering free meals at places where folks gathered. For example, last year we were at our place, we were at God's Love, we were at the public library, and we also had a team kind of doing a tailgate at the Walmart parking lot. And in those 4 locations, we had 2 sets of volunteers. One set of volunteers were our hosts. They were the folks that provided a hot meal, hot coffee, hot chocolate, whatever the meal chose to be. And those end up being faith communities, churches and religious groups volunteered and said, yeah, we'll provide the food. That'd be great. And so they did that. And the other set of volunteers are what I call counters. They're the folks who are trained to conduct the survey. And at each of those locations where meals were being served, and we promote this among our unsheltered neighbors, and the word spreads. And so they gravitate toward these free meals. And then while they're enjoying their meal, our counters sit down and interview them, go through those 20 questions or whatever, and then offer them a thank you gift for their participation. And that method, I was a little nervous about using that different methodology in terms of how accurate would it be? Would it affect our numbers? And as it turned out, our numbers during those 2 years, this last year, the first time last year, we had 181 was our count I mentioned, and we're going to do that again this year. We're going to be in some different locations. We're going to be at God's Love. We're going to be at St. Paul's Church, where we do conduct the shower program. We're going to be at the Good Samaritan Thrift Store. And we're also going to try a new location out at East Helena. The East Helena United Methodist Church is, they haven't made a final decision, but they seem to be very excited about partnering with us to do this. And which is helpful because East Helena has its own population that we may have been missing in previous counts. And by the way, I want you to know that we also count unsheltered folks, but we also count folks who are sheltered temporarily. And these are folks who are in the county detention center. These are folks who are at the YWCA. These are folks who are in the family program at God's Love. These are folks who are in possibly alcohol rehab facilities, who, if they were not in those facilities, would be unsheltered. And that's what we call a sheltered count. And our responsibility on that point in time night is the unsheltered folks. Also, we contact folks, sheriff and schools, folks out in Augusta, Wolf Creek, Lincoln, folks down in Townsend. We try to get the word out as best we can. It's hard to go to all those places in one night, but the folks in those communities know who their unsheltered neighbors are. And so we try to collect that data as well. Emily, what else would you add to the point in time survey?
So the one thing we know is that this is a snapshot of what the reality of the unsheltered number is. What the experts say is you can usually assume that your real number is about 10% of your population. So in Helena or the Lewis and Clark County is about 70,000 people. So our real number is probably closer to 700 people. And if you ask the people at the showers or the people down at our place, they would say that's pretty close to accurate because they know who's out there in the gulches and who's down at the parks. And they kind of know what's what in the unsheltered community. Because what we don't see is when we're out, when we're out on the streets on point in time night, or what we do in the count for the transitional living facilities or the shelters on those counts, we do not see the people living doubled up in houses, sleeping on people's couches, the people living in somebody's garage. We don't go knock on campers because that's not a safe idea. We don't knock on car windows. And we know there is a lot of that happening in the community and has been for years. And so there is a huge number of people that we miss in that count because there are a lot of people living unsheltered in a very number of creative ways in the community. We do go drive through a variety of RV parks and places around town where we know that people are living in creative situations. And we just sort of count those places as like a unverified count. Those don't get counted in the official point in time, but we keep those numbers on our own count. So we'll count the campers and we'll count the cars. So we know there's another 45 or so of those things happening that we drove around that night and saw. The other thing, those people that are doubled up or couch surfing, all of that, those are not counted even under HUD criteria. If you live in a camper that is connected to power and water, that is not considered unsheltered according to HUD criteria. And so the school district keeps their own count, and they count those kids as unsheltered according to the McKinney-Vento staff. And so they keep that count throughout the school year. And in Helena School District, they have about 400 kids that they keep track of throughout the school year that they consider unsheltered, even though they don't meet the HUD criteria. So, we have a lot of different numbers that we look at throughout the year that may not be counted in that point in time count officially.
Thank you. I just want to double check something that you said, Emily. My brain heard you say we can expect 10% of the population. But then the math was 1%. So did I miss something? Can you please clarify it?
Oh, yeah, I might have done math wrong. When we talked to the people at the HUD offices and the national levels, they would say, you can really think about 10% of your population being unsheltered or in that creative living situation, like the couch surfing, the doubling up. And I imagine that has to be true, because when you look at the apartments coming online in our community, the studio apartments are $1,200. The 3 bedrooms are upwards of $2,500 to $3,000. That is more than mortgages of people that I know. And I don't know how you get a 1-family unit into a place like that without extra people. I just don't know. I don't know how people aren't doing it without doubling up in some capacity. And so that when you start looking at how people are living in more creative capacities, they consider that in some way unsheltered, because you have some extra people living with you to be able to afford your rent. And so that, they start looking at that as, is that person unsheltered otherwise if they weren't living with that family to help one or the other afford the rent?
That's good clarification. Thank you. And would you all be willing to chat just for a bit about the continuum of care and what that is, how you work within it, and what it does for the state?
Because Montana likes to be different. We're the only state in the country that has one continuum of care. Most states have a continuum of care per bigger city. Montana does one, and then each larger community has a smaller continuum of care, but we all answer back to the one larger continuum of care. And because it works that way, none of the smaller continuum of cares are funded. We all do that work through grants or through community fundraising. And so then we also all do it a little bit differently. And so actually the state is working on getting us all on the same page right now, because it's been a little bit all over the place and not consistent. That's one of the efforts right now, is for Montana to get all of the communities that have a continuum of care on the same page, doing the same consistent work, so that we're not all trying to figure out which path we're on. So that's nice, because we all use what's called the Homeless Management Information System, but we all use it a little bit different and a little bit different capacities. And it's a great system if you use it well. It is a way to keep track of people that are unhoused, even if they're bouncing around from town to town. Like you said at the beginning, one of the things that we battle with uneducated community members is they'll say, well, people shouldn't move to our community. They should just go back to where they came from. Well, the majority of the unhoused people are from Helena or from Montana. We can see that they maybe came from Augusta or have a place where there's not a lot of services. They maybe came to one of the bigger towns where there's services or a shelter. But the majority of the people in our community are from our community or the surrounding area, maybe a smaller town around Montana, but they don't come from other states necessarily. It does happen, but they don't generally stay. And so we can see that in that system, because that's a national system and they use it, and we can see where people have been. If they've been in other communities and shelters and things like that, we can see if they've been in a shelter in Spokane or even in Oregon or wherever. So that's a nice thing to be able to see that a person has used services in other communities or bounced around. We just don't see it very often. We do see people traveling through. We even see people from other countries. It just isn't that frequent. And when we do see it, they are not staying very long. It's a very nice system to be able to have when a person gets into that system and says, oh, I see this person has actually been to all of the programs in town, but they're not actually connecting to a case manager. Let's get them connected to a person and get them consistent services, because it doesn't look like we're doing them any justice right now because they're just kind of bouncing around. Let's get this person some solid services.
And the way that plays out, the week-to-week face of our continuum of care, if you will, is what we call case conferencing. Each Wednesday, we gather. Pre-COVID, it was always around the table, but we now do a combination of Zoom and around the table. And we gather folks from mental health agencies, the hospitals, healthcare agencies. We have folks from the detention center, Helena Housing Authority, Helena Indian Alliance, and we have representation from at least one of the addiction services providers. And we gather each Wednesday. And my role is to go to that HIMAS database, the Homeless Management Information System, and I pull up the names of folks who are in that system. And you can pull their information by those who were last contacted. You can pull information by those with the greatest need. And then what we do and by the way, they sign off when they enroll in that system. They sign off on letting their information be shared in a confidential setting. So we are not talking about people without their consent. And what we do is we look at the folks on that list and we talk about who is in contact. Does this person have a case manager? What kind of help do they need? And as I mentioned earlier, are they compliant? Will they respond to the assistance that's available? Or are they doing the best they can in their current condition and their lifestyle that they choose? And one thing I'll say, and I remind our team often, and that is, and this is a helpful thing for the public to know, and an educator in Portland shared this statement, and I think it's true, and that is that homelessness is not a choice as much as it is a lack of choices. And what we try to do in case conferencing is gather the resources in our community and make them available as best we can to those who need those services. And so we go through that process each week. And I'll say this, roughly once to twice a month, we are able to celebrate as a group when someone does get housed, when we're able to hear that someone was successfully housed, or on some occasions they moved back to another location and found housing there. And it truly is something to celebrate when this person's name may have come up several times over the last few months and they finally get housed. So that process is challenging, and it takes all of us. Because as we've been talking today, the complexities, there's no shortage of complexities of what it might take to get a person to a place where they can be successfully housed. So that weekly conversation really helps us hopefully keep our thumb on the nerve of where our greatest needs are in our community. And so that is where the rubber kind of hits the road in this continuum of care. And that is meeting with the people who are working day in and day out with our unsheltered population and trying to match the availability of housing to the folks that need it most.
I'll just add real quick, because Jeff talked about people choosing their lifestyle. And one of the things that people bring up all the time is that the people that are unhoused want to be unhoused, which isn't generally the case. There is, like I said, a large number of unhoused people in our community, in the state, in the nation, especially since COVID. That number has jumped significantly due to the rise in housing costs. And, you know, there are definitely people who choose to be unhoused. There are definitely people who don't want to be a part of the system, who choose to live a different lifestyle. But a story Jeff tells, I should probably just let him tell it. But, there are people we work with who have been living this lifestyle for many years, who eventually just honestly say, I'm getting too old for this. And they choose a different path, and they realize, they are no longer able to live unsheltered. And they come back to this group and they say, I need to be housed. It's time to make a different choice. And yeah, they've been living that way for maybe up to 30 years or more, a long time, some of them. And then they realize it's time to do something different. So yeah, maybe they've been doing that for a very long time, but a day comes when they've made a different choice. And sometimes we've worked with people, for a couple of years, and we've pushed and we've tried and it's like, we're working harder than you are. And then one day the magic happens. So, yeah, yes, there are people out there that are making that choice, but it is not very many of the people that are unsheltered that are making the choice to live unsheltered. That is a myth. That is not true.
Yeah, I was going to add, Emily, because we do work with the statistics and we work with these agencies, that number of folks who, if you will, choose that lifestyle it's low. It's between 5 and 7%. It's a very low number that are chronically unsheltered and by choice. And as I describe them, just non-compliant to services. They would rather live this way. I'll even share a story of one gentleman right now who has been around for a long time, understands he has a serious addiction problem, and in more lucid moments, he and I have talked about, would you go with me to an addiction services place and at least have a conversation? And he indicated he would. When that day will be, I am not sure, but I'm ready. And so is the facility. I've had that conversation to prepare that. Someday I will walk in with this gentleman, and I hope we can help him, because he has never been in any kind of treatment, and he knows he has a problem. But he, like Emily described, the gentleman, he knows he's getting too old for this lifestyle, and he wants something better. And he wants to help the people around him as well. And he and I have talked about how he could help them so much better if he were in a better place himself.
Thank you for that, Jeff. People being ready to accept help, I know, is a really big factor in all of this. Jeff discussed this a little bit with the reluctance of people to participate in the point-in-time survey. And that is around, I suspect, the stigma that comes with housing instability and homelessness. And I just would like both of your thoughts a bit about how that instability impacts the people. We know that how the instability affects them, but that stigma mentally, physically, socially, and even health-wise, how it impedes their ability to find resources and to help keep them housed.
We think that our small programmable showers is nice, but one of the takeaways that we have learned is the value of just offering dignity to those who may feel less than because of their unsheltered situation. And one of the things that when I talk at local churches or various groups, I talk about offering humanity to our friends who may be flying a sign, smiling and waving. Maybe some folks have prepared a go bag that they could hand somebody some water and some, snack or something. I discourage folks from giving people cash. I always tell people, I could go into a whole different thing, but I talk about toxic charity. And I suggest that people give their money to programs who are doing the assistance work that needs to be done. But all that to say, folks are, frankly, get beat down by folks who will yell, "Get a job," or who treat them unkindly. And so I talk often about just smile, say hi, strike a conversation. There's a certain level of loneliness to this lifestyle that, and Emily will talk more about this, but there is this direct correlation we're talking about between health and unsheltered living is very real, because some people may not have a mental health condition when they begin their unsheltered journey, but because of the difficulty of the lifestyle may end up with a mental health situation as a result of that journey. And so as we've talked about the complexities, I think one of the greatest things we could do is just offer them the decency we would offer any other individual and help them understand. And I think we all need to remember that there, by the grace of God, go I. I mean, it's tough. My hope is that as a community, we can come together and not only educate, but better organize ourselves to really find some effective solutions that will offer them not only dignity, but, if you will, a series of stepping stones that can move them from being unsheltered to securely housed.
Thank you for that, Jeff. Emily, do you have anything to add to that?
Yeah, when we have panels of people that we work with or people that were formerly unhoused, they talk in depth about what it was like when they were living on the streets, that they literally feel invisible. People will walk by them and try so hard to not see them, and how lonely it makes them feel, that, and just how they feel like they're not human. And it's so sad that, they try everything they can do to be small when they go into places and not be seen. And just the inhumane way that people treat them because they're unsheltered, and it's just really, really sad. The way they talk about the way they feel when they're unhoused, it's really tragic. So we talk about, like Jeff said, just treat them like they're human. If nothing else, just say hi and treat them like they're human.
Yeah, it's okay to make eye contact.
That's right. And there's, hopefully podcasts and other informational resources like this can help people to understand a little bit more about the complexities, that you're not making assumptions when you pass somebody on the street and assuming certain things and moving on so quickly. Like you said, a smile and just some understanding around the situations that exist.
One of the specific projects we did a couple years ago in cooperation with Plymouth Congregational Church was a photo exhibit of 10, or I think it's 10 of our unsheltered neighbors, and a photographer volunteered his time. And the goal of that project was to really provide a glimpse, if you will, and bring some humanity to those folks who are unsheltered. We wrote a short bio of those folks, and their pictures were very friendly, very accommodating. And the goal of that was simply public education, to let folks know that, these are our neighbors. These are folks who have just come on some hard times, but they are our neighbors, and they are not a threat, if you will.
I'm familiar with that. That was a great project.
Yeah, it's an exceptional project. Our last question is clearly, it takes more than one person, one organization, or one well-oiled machine to address this very large and complex topic. And you've already mentioned a bunch of your regular collaborators in your work. Are there any other organizations that are really important to the partnership that it takes to create safe, affordable, accessible, quality housing options and wraparound services? And is there a place people can go for a list of those organizations or for some of the resources in town?
I think it takes everybody. I mean, literally all kinds of businesses, nonprofits, government agencies. When we started working on the community health improvement plan and we started having the action team meetings, we had a little bit of everybody. We have just individuals that are interested from the community. We have business owners, obviously, people from the downtown area that are most affected. A lot of nonprofits, the service providers, people from the local government, state government, all of those different parties of people get involved in the conversation because they are all needed in the conversation to make things happen. We will often have people show up at a meeting and they'll say, why haven't you tried? Or why don't you do? And then it's like starting over. So we have tried to create here's what we've done. So please, go to our website and get caught up. And, here's all the places we've looked at. Here's all the things we've done over the last few years. So we try to keep that, information on our website. Here's all of our collaborating partners. Our website is very busy. There's a ton of information there. It'll give you lists of all kinds of housing partners and housing information. But we try to do that because we don't want to have to rehash it at every meeting. But like I said at the beginning, we realized we were having 17 housing meetings a month in Helena. So we really looked at it. We communicated with all of our partners and we said, which ones can we combine? Which ones can we put on hold? What can we get rid of? And we've downsized a lot of those meetings so that we were spending more meaningful time getting things done. But when people get on our Facebook page, or if they get on a news article and they comment and they have a complaint, or if they have a misguided comment, or if they're uneducated about something, my very first thing is always come to a meeting, come down to our office, call me. We will have a conversation. I will tell you what's up. Like, I have no problem ever talking to somebody about what we're doing. If you have a concern, if you don't agree with me, let's talk about it. Come to one of our meetings, come and, discuss your concerns with our community members. Everybody is more than welcome to have that conversation with people. We are open to any and all ideas. We just want to get people housed in this community, and we're definitely open to whatever kinds of things people want to bring to the table. So, if there's somebody that's interested that hasn't been a part of this conversation, call United Way and we will figure out which meeting you need to be at.
An interesting dynamic of this is, I mentioned before, one of our newly housed neighbors trying to help his friends who are unhoused still. And over the last couple of years, we've seen our unhoused neighbors in different ways take the situation into their own hand. And they reach out to us as well and say, we'd like to do this. We want to start a campground, or we want to have this piece of property where we can live independently, or and they get very creative. And I'm trying to, I think I need some psychological training, because I think it's a very natural process as a person becomes somewhat more stable and maybe gets housed, or at least reaches a level of health and well-being, that they do immediately want to reach out to their friends who are not as far down the path as they are. And I wish I had a dollar for every time I've had a conversation with those people who come to me and say, how can we work together to fix this? And I have to remind them that we didn't get here overnight, and we're not going to solve it overnight. It's going to take time, and it's going to take people like you with the heart and a passion to help your neighbors. But it's also going to take policy changes at the local government. It's going to take law enforcement, education for law enforcement, and working together with the Fuse program and teaching even our unhoused neighbors that the emergency room isn't the best place to warm up. There's other places. So it takes all of us. And again, sitting in this chair and being a part of this continuum of care, we talked about gaps and why we're looking at supportive housing. One situation our friends in Bozeman face is all the cars, people living in cars and campers on the streets. And I've often thought, and our friends in Missoula did this for a while, they had what was called a safe outdoor space. It was a kind of a campground that was had security around the clock, had kind of a closed community, if you will. But I've often thought, what if we had a campground somewhere that was maybe it's fenced in, a gated community, if you will, but someplace for people to safely park, whether it's a camper or just a car or a truck, something that might be a low-cost facility, but maybe at the center of that is a warming house with laundry facilities, maybe a kitchen and a place to gather. It doesn't have to be a $5 million facility. It could be something that simple, but and we learn those things by listening to our neighbors. And I'm going to jump back to the showers again. I'm sorry, I was at the showers this morning, so it's kind of front of my head. About once a quarter, we do what we call a big day at the showers, where we have haircuts and Pureview Health Van is there, and we provide a lunch. And always we include a listening session where we ask our unsheltered neighbors to give us some feedback. How are things? What are your greatest needs? How can we as a community respond better to your needs? And they are bluntly honest, and they'll tell us what their real needs are. And I think that idea of a campground came out of one of those conversations. So, the complexities of that are, that's not an easy lift either, but it could be another answer to these challenges.
Jeff and Emily, you have both been able to shine a light on the just incredibly great work that's happening in Helena. And we see that there's a lot of cross-sector collaboration needed to find these kind of lasting solutions. And yes, of course, it does take time. We know also there's other organizations around the state working to improve health and housing. We also know that our chronic disease programs here at the state have a role to play as well. I guess I'm wondering if there's anything else you'd like for people to know as we wrap up this really great discussion today.
Well, one thing we didn't say in building that connection between health and housing, and I've got a few statistics here, but just to encapsulate it, a normal life expectancy, and this may be 2023 dated, this statistic, but average life expectancy for an American is 77 years old. But for people who have experienced homelessness, it's only 50 years old. So that draws just a blatant connection between the ability to be housed and secure and have all those things that housing provides and the connection to a person's health. And I can give other numbers that unsheltered folks have higher numbers, whether it's cirrhosis, HIV, asthma, hepatitis, all those things. Their numbers are significantly higher because of the nature of their living conditions. And so just to bring it full circle, the connection between a person's health and their ability to be safely housed is so connected. And to go back to Emily's point, that's why we focus on the housing first model. We understand that from a foundation of being housed from a safe, secure place, a person can then pursue their health or mental health or addiction or whatever their needs might be. That's why the housing first model has been kind of our moniker, because it is a proven, successful way to approach these issues.
We just held the longest night memorial service on the 21st. We hold that every year on the
Winter solstice.
21st of December, which is the longest night of the year. The sun goes down about 4:30. And, so really reflecting on that night when, people are unsheltered, and that's about 13 hours of darkness that night. And we remember the people in our community who passed away due to being unsheltered or the results of being unsheltered. And this year we only had 2 names that we read. And so we really focused on knowing that the reasons that people pass away sometimes due to being unsheltered aren't necessarily while they're on the streets. Sometimes it's once they're housed. And I always connect it to like when people go to college and that first time they go home for Christmas break and they're sick that whole entire week because they finally have that stress let down and their body just is like, finally they have a break and they're sick for that whole entire Christmas break. It's like that when you're unsheltered and you're constantly stressed, your body's on high alert, and you finally get housed and your body does that stress let down. And then a lot of times we see those folks pass away not very long after they become housed, after being unsheltered for a long period of time, because their body doesn't react well to that stress letdown. And all of the medical issues that they've been experiencing all those years really catch up to them. And like Jeff was reading off all of those different things, and you were talking about diabetes at the beginning, and lung disease is highly transferable in shelters, and so many things that we know are true about being unsheltered. And we talked at the beginning about mental health issues and chemical dependency issues, and it's kind of that chicken and the egg argument. Do people become unsheltered because of mental health issues, or do they develop mental health issues once they're unsheltered? Well, it's both. Both things are true, and same with chemical dependency issues. So we can't really say one or the other. And people always say, well, everybody that's unsheltered is mentally ill. Well, that's not true. It's generally true for the seen unsheltered people. And that's where you start looking at that high number of people that are living in cars and campers and garages. And those people are the unseen unsheltered people. Those people don't necessarily have mental health issues. They're just unsheltered for a variety of reasons. The people living on the streets are higher needs. They tend to have mental health and chemical dependency issues. Yes, but that's a very small number of the unsheltered population. So when you really start digging into the data and start educating people around all of this, you start going, well, what you believe to be true isn't necessarily true. The number of people with mental health issues that are unsheltered is small, a lot smaller than you would think, but the medical issues are very, very high. And the people who actually pass away due to being unsheltered is significant. And when we read the names at the longest night, it doesn't even touch on what's real, because we don't know. We don't know when the people become housed and then they pass away. We don't necessarily know that even happened, because they are housed and now they're sort of off our radar. And we don't necessarily find out till later sometimes. So, it's just a really unfortunate situation that happens, that, people get very sick and their body is just highly stressed, and it causes PTSD. And, so we see a lot of really, really bad long-term side effects from being unsheltered for people.
Thanks for that, Emily. I do some work around housing and housing instability. And I want to say to both of you, I've learned so many new things today, just insights on what you understand and know from your long work in this area. And I just want to thank you for that on behalf of myself and Trina. I think we've had a great discussion. Again, thank you from us and the crew behind the scenes. And thank you also to both of you for working intently on developing comprehensive housing and care services for people that are experiencing housing instability and homelessness. If you'd like more information on what was discussed today, please visit our website at talkinghealthin406.mt.gov, where there's links to the information that's been discussed. And if you haven't already, please remember to rate, review, and subscribe to our podcast. And until next time, be healthy and be well.